Okay, well, hello everyone. I'd like to welcome all of you to our standards webinar batch number 2. Thank you so much for taking time out of your busy days to spend time with us, and thank you for engaging with us to learn more about things that I'm really passionate about, which are professional standards. My name is Mary Catherine. I am the manager of practice advice service here at the college. I've been a practice advisor with the college now since 2020, just coming up to my 5-year anniversary. I'm a physiotherapist, a proud graduate of the University of Ottawa Physio program, as well as a U of T graduate from the Rehab Science program. My experience as a physio has brought me to a variety of settings, including acute care hospitals and rehab facilities. And for the 15 years prior to joining the college, I worked in private practice, both as a clinician and as a director of a multidisciplinary clinic. So as a practice advisor, my role is to know the professional standards and help all the partners of physiotherapy care in Ontario to also learn and understand how to apply those standards and how it might affect your specific situations. I am not, however, a health policy expert, but lucky for us again, we have someone with us today who is. So I'd like to introduce you to my colleague, Evgenia. Evgenia, over to you.
Yeah, thank you so much, and good afternoon, everybody. My name is Evgenia, and I'm a policy analyst here at the college. So like MC, actually, I have also been here since 2020, and I've been working closely alongside the practice advice team and some of our other college program areas over the past couple of years to review our standards of practice. And we are also joined today by a member of our communications team, Allison, who will be collecting your questions today and managing the Q&A function. So today, we will be guiding you through an overview of 2 new standards of practice that have taken effect this past November 1st, and they are on your screen. These are the Evidence-Informed Practice Standard and the Titles, Credentials, and Specialty Designation Standard. And you will have the opportunity to send your questions throughout the presentation in the Zoom Q&A function. And we will be taking some time to answer your questions at the end of our overview about each of the standards. So we'll have one space for questions kind of in the middle and then once more at the end. Okay, now before we dive in, we're going to first be launching a quick poll. So the question is, have you commented on these 2 standards when they went out for consultation last March until about late June? So just to get a sense of whether you've had the opportunity to send us your feedback in the consultations process. Give everybody some time. All right, perfect. Well, thank you so much, everybody, for responding. This is all very good to know. And it looks like maybe some of you guys didn't have the chance to respond to the consultation. Totally all good. All right. Now we can start. So before we, actually, yes, why don't we show the poll results first before we dive into some of the background? Perfect, that's great, just so that everybody can see how everybody responded. Skip that step for a bit. Okay, wonderful, now we can begin. So before we dive into each of the 2 standards themselves, I wanted to kick it off with just a quick recap of how we got here. So why we're reviewing our existing standards and why we're coming up with new ones at this time. So this is now the second group of standards to be reviewed in a bigger project to align a national package of standards called the Model Standards of Practice with kind of our practice environment here in Ontario. So the national standards have been developed collaboratively with the physiotherapy regulators in all Canadian provinces. And the goal here is to outline where physiotherapy practice is similar across all of the different provinces in our country. So this is where the term model standards comes in, because each province then models or customizes those standards according to what works best for their context and what makes the most sense for their province. So that is what we're doing here. Our college is adopting 16 of the national model standards in total, and we've split these up into 5 groups for review, just so that all the standards get a bit of a more thorough consideration. Okay, so with that context in mind, we can now officially get into the second batch of standards. And we'll be kicking it off with the evidence-informed practice standard, which is a new standard here at the college. The purpose of the standard is to ensure that physiotherapists engage in evidence-informed practice in physiotherapy service delivery. So for the standard, what this means and what this term refers to is the combination of first, best available evidence, second, your clinical experience, problem solving and decision making, and third, the perspectives of your patient. So when all of these things are taken together, you get evidence-informed practice for this standard. Okay, so the performance expectations first highlight that before clinical evidence or research is incorporated into practice, PTs must first critically appraise and evaluate that evidence as it relates to their practice setting, the population of people they serve, and the treatment options that are available. So to critically appraise evidence here means to go through a process of carefully examining the research to judge just how trustworthy, valuable, and relevant it is. And according to the standard, this isn't a process that's kind of one and done. This evaluation should be going on in an ongoing way as things are changing. And as before, the evidence must also be accompanied by a physiotherapist's professional judgment and a patient-centered approach. Now, when it comes to communicating information with others, the standard states that physiotherapists must not share or promote information, treatment options, or products that are not in some way supported by science. And the last kind of half of the standard, it outlines how physiotherapists should approach emerging and complementary therapies. So what are emerging and complementary therapies? Emerging therapies in the standard are those that come from mainstream physiotherapy and have some support from clinical research, but they don't quite yet have strong enough evidence to be considered standard or best practice. And complementary therapies are not physiotherapy treatments on their own and in and of themselves, but these may be used alongside standard regular conventional physiotherapy in the course of treatment. So for both of these therapies, physiotherapists must understand how they fit within their practice. They must evaluate their own skills and knowledge before using them, and of course, ensure that their patients give informed consent for these types of treatments. And physiotherapists must also make sure to offer best practice or more mainstream physiotherapy approaches to their patients before fully exploring emerging or complementary therapies. Okay, so that's it for what the standard kind of highlights, and that was a lot of theory. So I will now hand it over to MC to take us through what this might look like in clinical practice.
Sure. Thanks, Evgenia. So what's new about this standard is all of it. We've never had a standard that has set expectations around the quality of the evidence in our treatment options before. So let's just, to ground us, review that definition of evidence-informed practice from within the standard is that it's practice that's derived from evidence-based practice and involves clinical problem solving, decision-making informed by integrating best available evidence, the patient context, and the personal knowledge and experience of the physiotherapist. So one thing to remember is that evidence-informed practice is not only the application of research evidence, it's that phenomena that emerges from the interaction between what the evidence is telling us, what your experiences are clinically as a physiotherapist, and what that patient experience is. And remember that the patient-centered communication and care remains at the forefront of evidence-informed physio practice. So it really requires us to appraise why we do what we do, really have a look at some of these new or emerging therapies or modalities or approaches and have with a critical eye of why we're doing that. Ensure that we as physios know what the legislative and regulatory approvals are to incorporate these new approaches. Can we do them where we are here in Ontario? Does it make sense here in Ontario? And that we don't promote information or treatment options or products that are not grounded in scientific and physiologically plausible evidence. So there were questions that were raised during the consultation process, and some of those we addressed in the January edition of Perspectives. January is a very busy time for all of us, and I don't blame you if you're like, what was that January edition again? So we're going to link it here to make it easier for you to access. But a few people came to us in practice advice and said, it's been a long time since I've evaluated a research article, or maybe it wasn't something that they had learned about in their training about the levels of evidence. So a good place to begin your review of evidence-informed practice might be a summary article, such as the one that we had suggested from Physiopedia. We're going to link it for you today. And it was linked in that January edition of Perspectives. It includes some of the basic principles and strengths and weaknesses of evidence-informed practice. And it goes on to give you some clues and some tips around how to deepen your understanding about what to look for, the quality of the information that you're reading. And there's a review of some of the levels and grades of evidence. Now, this takes time, and you guys are busy. We hear it a lot. I have also been a very busy clinician. So consider subscribing to a research summary service that could send you that relevant information right to your inbox. For those of you who are already CPA members, you can access and subscribe to research reviews such as PEDRO and OrthoEvidence. And I'd love to hear your suggestions. If you have other ways that you save time or you get relevant research sent to you in a timely way to allow you to incorporate those into your practice, please drop them into the Q&A, and Allison is going to provide a summary of those suggestions for us at the end of the webinar. Another question that we had was around how to share evidence with patients. How much to share? Does this need to be documented that we've shared the evidence with patients? And I think that conversations around the evidence are often part of the consent conversation. You want to share enough of the relevant research to allow the patient to understand your clinical reasoning while you're making certain decisions. For example, if you're working with somebody and you're treating their osteoarthritis, you could share with them that the strongest levels of evidence for effective care include exercise and education, and that's why you'll be using exercise and education through each phase of their rehab plan to address the osteoarthritis. Another question that we had that came in was around how do I balance being innovative with using evidence? So, of course, as a college, we want you to focus on providing safe and effective care. Patient safety should never be compromised, nor should patients be used as test subjects with new or emerging therapies. So if a patient was harmed in the course of providing a therapy that didn't have good evidence, it would be on that physiotherapist to provide their clinical reasoning and their levels of consideration as to why that specific intervention was chosen at that specific time. So those are just some questions that had come in ahead of time. And then I thought we could give, on the next slide, we'll give a clinical example of how maybe to integrate what this could look like in a real situation. So in our example, a physiotherapist named Céline recently learned about a new device that helps to relieve tendon pain through a lunch and learn sponsored by the company that makes the device. So using this new evidence-informed practice standard, what could our next steps include before implementing it into her practice? So based on that, the new standard, the first thing she could do is to review the evidence from sources that are independent of the manufacturer. That would be a good place to start. For her to verify the legislative and regulatory approval, she'll want to check Health Canada's website for medical devices to see that is in fact been approved for the reasons that she wants to or is considering using it. She'll want to ensure that she's already engaged in current best practice for tendon rehab before trying the new device. And Céline will want to discuss the evidence with the patient to ensure that they understand it is emerging and to document that that conversation occurred in the patient's chart. So are there any questions that have come in? So no questions yet in the Q&A that I can see.
Okay, perfect. That's all right. We will have another space for questions in case something else does come up at the end. So we can chug right along to the next standard, which is the Titles, Credentials, and Specialty Designations standard. And this one replaced the college's previous standard on restricted titles. Okay, so the purpose of this one is to ensure that physiotherapists identify themselves using their protected physiotherapist title as well as their other credentials, and they do so in a manner that is accurate, transparent, meaningful for the public, and not misleading. So in terms of the performance expectations, here the standard highlights that registrants first should know that the title physiotherapist is legally protected in Ontario. And as such, they do not help anyone who isn't registered with the college to falsely hold themselves out as a physiotherapist, and that they report any of these instances to the college as they become aware of them. Next, in terms of using the protected title, physiotherapists must present their title physiotherapist or PT or the French equivalents of these English terms in all their professional interactions, and they must list it after their name and before any academic credentials or other professional designations. And we will actually be going through what this ordering process of a title might look like in just a little bit. So titles must be used in accordance with your class of registration. So for example, an independent practice certificate holder would just use the title physiotherapist, PT, but this would look different for other registration classes. So for example, in the new emergency class, the title one would use would be physiotherapist and in brackets, emergency class. And next, the standard also states that the protected title must not be used in a manner that is false, misleading, or deceptive when engaged in activities that are outside of the physiotherapy scope of practice. And the goal here is just to not confuse the public about what is and is not physiotherapy, making sure that titles are aligned with the physiotherapy scope. For academic credentials used as part of a title, these need to be conferred by accredited university programs, be listed accurately, and have some meaning for the public. Now, in terms of the use of other protected titles, first, according to Ontario law, physiotherapists are not allowed to use the title doctor or its abbreviation DR. When providing or promoting health services to patients or acting in a patient-facing manner. So very important to note. And PTs must also not use any other health professional protected titles unless, of course, they are also registered with that profession's regulatory college. And the last bit of the standard is going through the specialist designation. So under the standard, physiotherapists must not refer to themselves as specialists unless they hold a specialty designation from a certification body that has been approved by the college. And the designation is listed after their protected title and is on the public register available. So that's it for the performance expectations. I'll now turn it back over to MC to discuss once again the questions and how this all might work in practice.
Thank you, Evgenia. So what's new on this standard? It looks very similar to the previous standard. One of the things that's new is this use of the emergency class registration. The emergency class was created in 2023 based upon input from the government, and the purpose of the class is to allow registration of applicants on an emergency basis should either the government or the board determine in the future that emergency circumstances require it. Although not new, there is clearer guidance now to use our protected title first, followed by academic credentials. And there's very specific guidance around avoiding using our title when we're engaged in activities that are outside of the scope of a physiotherapist, scope of practice of a physiotherapist. So for example, when you're teaching community classes where people have not been individually assessed, or when you're holding dual titles and you're providing care that's more in line with your second title and practicing within that second scope of practice, you'll want to be clear with patients which title you're really practicing under. So how this might affect your practice is that the standard solidifies the importance of using our protected title as well as our protected abbreviations. So if you hold a provisional practice registration, be sure to use your PT resident title when you're speaking with patients or on any materials or advertisements that are patient-facing. I would say this is a good time for all of us to review our business cards and our email signatures. Many physiotherapists are not using their protected title accurately, or they're using a previous one such as RPT, which should be avoided, or they're only using their university degree immediately after their name. So you want to make sure to use that PT right after your name. A reminder that physiotherapists can never use the title of doctor when providing clinical care or performing patient-facing activities. This also includes in social media because patients would be accessing your social media accounts for clinical care if it's a clinical account, and your email addresses and signatures. So if you have an email address that includes your title, a title of doctor, you'll want to consider changing that to avoid confusion with patients. And of course, we'll want to avoid using your title if you're not providing physiotherapy care in any other context. So some of the questions raised by registrants during the consultation had included who is allowed to use the term specialist. And it is only those physiotherapists who have successfully completed a recognized specialty certification program and have registered and ensure that this information is included in the public register. So as of right now, this includes only the specialty programs that are available through the Canadian Physio Association and the American Physical Therapy Association. A second question that came in a couple of times related to this standard was about physiotherapists using their title when providing animal rehabilitation. And because we have our protected title through the RHPA, which is the Regulated Health Professions Act, this only applies to human patients. So we should not be using the title of physiotherapist or our initial protected initials when providing care on non-human patients. And then finally, a very common question is, what should my name and title appear and to look like on my business card? So I thought, I created an example that might make it a little bit clearer. And so here is our physiotherapist. Her name is Céline. And so you can see immediately after her name is her protected title of PT. Now, while Céline was in Las Vegas, she was busy completing her doctorate of physical therapy, as well as some research in neurosciences, and got her PhD. However, she cannot refer to herself as a Dr. Dion on her business card. So you'll see she has her degrees listed, but not the title of doctor or DR. And because although she has a very focused practice, she's not completed a clinical specialty program, and so she does not include the term specialist on her business card. So there's your example of a business card that everybody can use. All right. Do we have any questions related to this? So a couple of questions that have come in related to the titles. If you are acting as a personal trainer, you cannot use your PT designation in that capacity. That is correct. If you are not working, if you have dual roles and you're working as a trainer, you should use the title of trainer and not use the title of physiotherapist in that regard. There's a question around, is there a list of CPO approved specialist designations? And that list is available in the standard. It's listed asterisk, I believe, at the bottom of the standard. There's a question around providing, if we're providing a general information session to people, we can't use the title of PT, but can say I'm trained in physiotherapy. So we can say that we are if you are a registered member of the college, you can say that you're a registered member of the College of Physiotherapists of Ontario. The general information sessions are really there to provide general information. It's important to have that caveat that you're not providing physiotherapy care. And if someone has received information from a healthcare provider who has individually assessed that person, that information should take precedence over the generalized information that we provide in a general education session. There's another question around, is there a specialist title in the area of vertigo or concussion that the CPO approves? So we know that right now the program through the CPA is temporarily on hold. Our registrar is aware that it is an important program and is in contact with the CPA about it. if you have specific questions around their specialty programs, you can reach out to the CPA. I know that in the APTA specialization program, they have a list of 11 different programs. I'm not aware, there is one in neurology. I'm not aware of one that's specifically in vestibular rehab at this time or concussion. Okay, and I see one more question that's come in. So the question is, where would we put work titles related to the business card? So for example, if you're the clinic director, so you would typically put that after your university degrees, if that makes sense to you. Or if you're a clinician who's also a clinic director, then you could put it, it probably makes sense from a public facing to put your qualifications or the information around your specific practice together and then your clinic director title, but there's no, the college doesn't have a specific rule around where to put your clinic director title. So we had a couple of other questions that came in regarding the first standard that we covered, which was the evidence-informed practice standard. One question is, in an audit, what would be looked for in the documentation for evidence of this standard? That's a great question. I think that what you're going to look for is the evidence of the clinical reasoning. You're going to look to see that there is a logical step between the symptoms that have been found, the physiotherapy diagnosis, the goals of treatment, and the treatment plan. So there should be a real sequence logic of what's there. There should be, for example, if you're using an emerging therapy, there should be evidence in the chart that the best practice has been accessed first and that the results weren't satisfactory, and so therefore this new emerging therapy is being trialed, for example. So it wouldn't just be one line, it would be probably the documentation as a whole that would go to point to that. But it hasn't come into play yet. So that's why I think that's a really great question. There's another question around where can we find best practices accepted in Canada or Ontario? Again, terrific question. I think that what you're going to look for here is to read your journals that are coming from the association, read your specific journals that are coming from the areas of practice that you're working in. You'll see a lot of information there. There will be summary articles available through, for example, the Journal of Sports and Physical Therapy, the JOSPT journal will often have clinical practice guidelines, which they're not specifically to Ontario or Canada, but they will be kind of a well-read, well-recognized place to access that information. Speak to your colleagues, get an understanding from them of how they access care and research information, and have a look at those research summary services that are available if you're a member of the CPA, to see if you can get information from there. Allison, did we cut all those questions in? Well, thank you so much for all of you for coming today. It's been so great. I just wanted to get a last sense from you around how are you feeling about all this? This is a new one today. So what's your pulse check? Are you feeling confused? Are you feeling kind of neutral about this whole thing? Are you a little frustrated? You're already busy. This is just adding. Are you optimistic around how you can see that this maybe serves the public interest and can serve to strengthen our profession? We'd love to see how you're feeling. And then just as a reminder, you can always access the practice advice team. We're available for you. You can access by phone or by email. You can do it anonymously if it's something that you would prefer to remain anonymously, or you can give us a call and chat through. And we have lots of repeat callers. We love to chat with you. So we're happy to have to answer those questions for you as we can. And we look forward to seeing you at our next group of standards, so Standard 3. That'll be our third group, Evgenia.
Yeah, thank you so much. Not much to add there. Also wanted to thank you all for being here today and for taking the time and for all the fantastic questions you've raised today and the feedback that you have been sharing throughout our consultations process. So very much appreciate all your engagement there. And we hope everyone has a fantastic rest of your day. As always, we're just an email or phone call away if you have any other questions. Thank you so much, everyone.
Thanks, everyone. Take care.
Bye now.